Hi, my name's David. I want to share my cholesteatoma surgery story. This is less than 24 hours out from surgery. I had surgery yesterday. It was 6 hours long. The anesthesiologist told me it was going to be about 2-3 hours. My surgeon was Dr. Carey out of Johns Hopkins, who's fantastic. He said, we expect maybe several hours, 3 to 4 hours. Turns out it was 6. The cholesteatoma was pretty extensive. It had eroded through all the bones in my inner ear, and Dr. Carey had to reconstruct them all. In about 6 months, I'll go back and we'll start talking about maybe prosthetic bones inside there. Not quite sure, but pain manageable. I'm actually not on any pain medication right now. Just using Tylenol and ibuprofen. Very little dizziness. It was dizzy yesterday because I came out of general anesthesia, but other than that, not much dizziness at all. I feel fine. I feel like I could walk around, do whatever. As you can see, it's it's draining out blood like it's expected. I'm a wrestler, so I have cauliflower ear, pretty extensive cauliflower in my right ear. So Dr. Carey had to make the hole in my ear canal bigger. So he had to kind of drill through the cauliflower ear, and he said that was actually pretty difficult. It's kind of funny if you're a wrestler and you have ear problems. But my cholesteatoma is not related to wrestling. It's not related to my cauliflower ear. I grew up having ear infections probably since I was a baby, and they were misdiagnosed, and just over time, ear infections got worse and worse and worse. And I tried to toughen through them. I didn't go to doctors, and I didn't get antibiotics, and I didn't treat them properly. So eventually I had the growth, and it just started to erode away at things. Leading up to the surgery, I didn't have drainage. There was a period for maybe 6 months where I did have drainage at night, and I had to stick a cotton ball at night so it wouldn't drain out. But other than that, I didn't have any dizziness from my cholesteatoma. I didn't have any pain, no drainage. Very little foul smell, not bad at all. So I kind of ignored it. Excuse me. Kind of ignored it. I put the surgery off for a while because I didn't think it was that bad. After the surgery, Dr. Carey said it needed to be done. It was pretty bad, and it had to come out. It was destroying the bones in my middle ear, and it had eroded away a real tiny hole in my mastoid bone. So it needed to be done. To anybody that has to go through the same thing, needs cholesteatoma surgery, get it done. Get it done because this thing, it eats away at everything inside the ear, and it doesn't stop, and it can cause a lot of problems down the road. So if when you first find out you have one, get it removed as soon as possible. I'm sure I'm gonna need another surgery in my right ear, which I'm not really worried about. My left ear, I have a cholesteatoma inside there too, but Dr. Carey said that he doesn't think that one's going to need surgery for a while. And they think they can clean it out manually in office. But other than that, I feel great. Like I said, I'm not dizzy. I'm not nauseous. I'm not in pain whatsoever. I'm taking ibuprofen, Tylenol around the clock, and that's basically it. Yeah. It's my story. I'll update in a couple days. Once I get the packing off and I can take this off in 2 days, I'll update again with the incision. Thanks.